And the longer that I was a paramedic, I realized that there are fundamental things that are broken, that patients are counting on us to figure out.
But one thing that I've always admired about paramedics and EMS, and again, I humbly will admit I don't have the ability to deal with the emotional toll and the stress that you guys have to deal with.
The trauma surgeon might be at the pinnacle of the game, taking the patient to the OR, but they are supported by dozens and dozens and dozens of other people. And they are counting on all of these people working for a shared mindset.
And Dr. Porter said something to me in that podcast that I have not forgotten. Andre, as a chief trauma surgeon, there is one referring physician that I value the most, and that's my paramedic. Welcome to the Bedrock Way Podcast, where we're changing the habits of yesterday by creating the new healthcare reality of tomorrow. And Jonathan, do we have a treat for the audience today? We have a treat. And I will tell you, the universe is very, very, very sneaky sometimes, but the universe always smiles down on Bedrock. So a few months ago, we had a guest on our podcast by the name of Dr. John Porter. And Dr. John Porter is one of the most renowned chief trauma surgeons in the region. He's actually the chief trauma surgeon and a bunch of other things for Cooper medical health system in the area, one of the biggest health centers in the area. And Dr. Porter said something to me in that podcast that I have not forgotten. And he said, Andre, as a chief trauma surgeon, there is one referring physician that I value the most, and that's my paramedic. And I said to Dr. Porter that day, I have never looked at EMS and that team as a referring physician, as a lifeline, no pun intended or pun intended, to the healthcare system. And quite frankly, after reflecting, EMS and paramedics are the referring physicians, are the lifeline. They are the first line of defense, and they are usually the unsung heroes. And they're usually the ones that don't get the most credit. And they certainly are not compensated, as other healthcare providers are. And after I'm talking to Dr. Porter, I said, man, I got to go out and find me a really good EMS worker, employee, associate that is really making a difference out there in that space. Because Dr. Porter really resonated with me that day when he said that to me. And the universe did me one even better. I didn't have to go get it. I didn't have to go get that person. The universe brought that person to me. And it brought my guest today, Mr. David Lacombe. And the title of our podcast today is Saving Lives, Changing Lives, the Inspiring Journey of an EMS Trailblazer. Welcome to the Bedrock Way Podcast, David Lacombe.
Thank you very much. I've been looking forward to our chat.
Tell me and tell the audience, David, let's start off with just your background that really has a very diverse, content, and then how we came to talk today, and really some of the, I know you're writing a book and you're very accomplished in various projects you've done. The things that I want to really focus on is a partnership with the American Heart Association, where you made an impact in 70 cities in the country, which to me is incredible. And you were able to enroll 40,000 healthcare providers. I don't think there's anyone or a lot of people in this country that can say they enrolled 40,000 healthcare providers. So your footprint, your legacy is being written as we speak, and it's one that's extremely impressive. So let's talk to the audience and let's give them a little bit of a taste of what David Lacombe is.
Let's go back early career. I had ambition to be a paramedic. And when you get there, you have this idea in your mind of what you're all about, right? It's really one-on-one. Even though you might be in a very busy EMS system, you're still caring for one patient at a time most times. Every once in a while, you run into situations where there's many people there. And it didn't take long for me working in that environment to realize that, you can make an impact for that one person Sometimes it's hand holding, sometimes it might be life saving. But there was something nagging at me. What more could be done? I developed an early interest in improving systems of care. That, when you mentioned earlier, the trauma surgeon who was in there, the trauma surgeon might be at the pinnacle of the game, taking the patient to the OR, but they are supported by dozens and dozens and dozens of other people. And they are counting on all of these people working for a shared mindset. And the longer that I was a paramedic, I realized that there are fundamental things that are broken, that patients are counting on us to figure out. So when you dial 911, let's say, for example, a catastrophe strikes a loved one at home. When you dial 911, your only expectation is that they get there quick and they are extremely competent and everything is going to get better the moment they arrive. And the reality is, in a lot of places in the country, that does happen. Unfortunately, there's also places where it doesn't work just right. There was a specific type of case that was so time sensitive that caught my attention early in my career. And that was the person whose heart suddenly stops, their breathing stops without warning. This is called cardiac arrest. And from the time that happens, you have about 600 seconds for everything to come together flawlessly. In most communities, it doesn't ever happen. Most cardiac arrests occur at home. Most are not witnessed. And you are counting on a system which is not optimized to save your life. From the science perspective, a witnessed cardiac arrest in the company of a paramedic, that is 100% a survivable event. But if that paramedic is delayed in traffic, if they're not preceded by a law enforcement officer or a lifeguard at the beach or a loved one, in your home who sees you collapse and starts CPR immediately, you are eating into your 600 seconds. And by the time that we get there, what you're going to appreciate that suddenly things start to get very busy. Maybe firefighters are arriving at your house and paramedics are arriving, and you see lots of activity, but all of that activity results in a failed outcome. The patient doesn't survive. So this, if you fast forward 20-something years later in my career, this same type of dynamic happens in business. We mistake lots of activity, right, as being, productive, and, we like that. But if the activity doesn't generate a desired result, then it's waste, right? So in the healthcare environment, that would be the, unnecessary loss of life. And when we're talking cardiac arrest, I think most people think it's an elderly disease, people who are at the end stage of their life, they're 70 and they're 80 years old, and that's just how they pass. And the reality is people who are much younger than us, right, in their teens and their 20s will experience a cardiac arrest just because it's their time, right? And so you take a 20-year-old person who hasn't even begun to hit their prime and you remove them from this world, there is a net loss, right, in terms of the value that could have been contributed to society. These things were nagging at me. And that led me on, after a career of 20 years of being a paramedic, of how do I apply all of these direct observations of one-to-one care, and how do you transform that experience into systems of care thinking? And that really became the next chapter in my life.
I will tell you, it's incredible to understand, and I've never thought about it this way, Dave, the 600 seconds. 600 seconds. This podcast might as well be called the 600 seconds and making the most of our 600 seconds. And I think that expediency that you see as a paramedic, where time, you're always working against time. You're always working against time, and you have to squeeze every efficient ounce of that time. And I think seeing that for so many years, right, almost expedites, or I should say exacerbates, the need for you to accelerate, for you to make the most out of your 600 seconds. And I think that making the most out of your 600 seconds, we can also juxtapose that to life. Making the most out of the 600 seconds, making the most out of our life, period.
Yes.
Right? So, but one thing that I've always admired about paramedics and EMS, and again, I humbly will admit I don't have the ability to deal with the emotional toll and the stress that you guys have to deal with. So just walk my audience before we get into the systems of care, which I think is very, very valuable because, again, it provides for us a foundational hindsight look at how you came to be who you are today. But how were you able to deal with, I'll go back to the surgeon again. Dr. Porter said to us that the number one, and we actually corroborated this, the number one suicide profession is a surgeon, followed by physicians, followed by police officers. And I would venture to say that you, as an EMS paramedic, will see as much misery as the aforementioned. So, but your suicide, your mental health is not at the level that theirs are. And I'm talking from a decreased perspective, right? From a deleterious perspective. So how take us through your training to understand and almost have that, I would call it almost be desensitized, right? Almost be desensitized to witnessing death, because I don't care what profession you're in. There are very few that you're going to experience death. Very few. For you, it was almost a guarantee that you are going to see it daily. Misery daily. And we always say when death occurs in our presence, the person who passes is the one that suffers the least, because there's a familial wave and there's a ripple effect that now you as the provider need to handle, right? So tell our audience the training that allows and empowers you and other EMS providers to be heroes every day, but almost be desensitized. And Dr. Porter said it. Andre, we have to almost be disconnected emotionally, because the minute that I don't save someone, 5 minutes from that time, there might be somebody else.
Yes.
And if I haven't gotten over that case, I unfortunately cause harm in other case or other cases. So I always admire the fortitude of the human spirit and the resilience of the human mind. So I don't want to be remiss and not tell our audience how you and all of your colleagues out there who are doing this daily servitude of healthcare, which is undervalued and I think underreported, how you guys are able, and maybe it comes from your training, maybe it's just, I always say maybe you're just led to that profession and you guys are just built different. But I think there has to be something about you guys that we can strip away and almost put that pixie dust, right, into other people. Because I think right now, 36%, there was a stat the other day, 36% of people are happy in their life. That means that over 60% of the people in America are unhappy. Think about that, right? More than half are unhappy with their lives. And we know that there is a tremendous amount of low mental health that we're dealing with daily. So talk to us about that.
Let's start off with most of my peers all entered into the profession because they had a genuine interest to help other people. Now, the part that's going to surprise you is there was nothing in my training that prepared me psychologically for what I was going to say. It wasn't until you start working with more senior paramedics who model both good and effective coping, responses. And if you're observant, you watch the ones who are effective, and you also learn from the ones who aren't. I've seen a lot of destructive behavior amongst my peers, and it's no doubt it's attributed to the things that they say. So, fortunately for me, I found my way early, where I was able to create a little bit of a dissociation. But I would tell you that anybody who says, you have to completely shut yourself off, I think it's a soundbite. I think you can never shut yourself off from seeing human suffering. There's not a switch, there's not a pill, there's not a mantra that can keep you from experiencing it. For me, I always reminded myself, I did not create the situation. I've been the one who's been chosen to come in and try to make it better. And if you can start making things better, even in relatively hopeless situations, then you've done your bit. But I would just kind of tell you that if you don't get some clarity in terms of like My job is to coordinate. My job is to lead. My job is to communicate. If you're trapped in your own head and you're not able to get out of that and do what you're there to do, then the calls don't go well. And listen, I'll be very frank with you. There are lots of EMS calls that don't go well. They're mismanaged. Sometimes they are so chaotic that it just takes a period of time to get control of them. And, you're lucky if you have an experienced EMS crew, right, who understands the dynamic and is able to actually start, making sense of it.
Let's talk about what you said about the instances of, and I agree with you, the inability for the human mind, spirit, eyes to disconnect, from what they see as destructive results, which kind of leads for them to create destructive behaviors within themselves,
Yep.
which I almost equated to a PTSD type of dynamic, right? Where the emotional, we are, unfortunately or fortunately, we are byproducts of our environment, right? We talk about genetics, but there's something called genomics. We talk about it all the time. Genomics, there's a tremendous amount of involvement within the environment. So for a paramedic EMS individual, there's almost a derivative of PTSD, almost natural, right? Two-folded question. Tell me more about the destructive behaviors that result. And how many times, you said 20 years you did this, right? How many times you thought of quitting?
I probably thought of quitting more times than I thought about staying. It comes up into your mind of like, am I fulfilled? Is this what I thought it was going to be? Am I making a difference? Am I appreciated? Can I support my family on this income? And none of those times led me to actually following through on it, but the fact that it popped in my head was a signal to me that there was something missing, right? I've seen some destructive behavior where people will just quit, and they never fulfilled their potential. The adversity that they experienced was enough for them to, maybe they've never really experienced adversity before, and now that they're feeling it full frontal, they're like, oh, I don't want this, right? And the truth of the matter is, I think in a lot of those cases, they just haven't developed the fortitude or the coping mechanism to say, this is bad, I'm not having fun, I'm not feeling rewarded, I'm just going to leave it. And so they didn't fulfill their potential where they could have really been something terrific if they just give themselves the chance. So that's a little bit of, the behind the scenes of like when you see an ambulance driving by in your neighborhood or your town, you kind of think like, oh, you can see the cape, flapping, right? There goes these guys and gals who are going to help us. And the truth of the matter is they all leave their homes in the morning to go to work, right? And the best of them get into a mental mindset of like, I'm here to serve. I know that I will be surprised today by something, right? And I will respond in the following way. So mid-career for me, I really got much more involved in like, these mantras of like how I will behave when certain things that I'm not expecting come up. So it could be a conflict on a scene with a peer. Like it's not, EMS isn't like is like every other profession. There's people who disagree with each other. There's people who you like and you don't like, and there will be tension. So some of the destructive behavior that you were looking for was, I've seen, full conflicts of like relationships being really destroyed between peers because they let their emotions get, ahead of them, as opposed to slow down. We're both tense. Let's take a break. Let's come back. Let me listen to you. I know you're going to listen to me. That's a rare instance. Like I found it in public safety. We're alpha dogs. We tend to lead, with a sense of power. We need that for our own self-preservation a lot of times on calls. But you have to be able to throttle that. You have to be able to, make yourself vulnerable and, reveal to the people who matter most to you of like, hey, I'm ready to listen. Maybe I did something wrong. Maybe you saw something you didn't like. Why don't we talk about it? And it doesn't have to be an affront. It doesn't have to be a threat.
We see, I'm just doing a little bit of research, David, and the paramedic profession back in 2011. So there was an estimate, this is by the NIH, there were 216,000 in 2011. 2019, it grew to 290,000. And there's been a heavy increase in females participating and joining, 35% versus 65% male. And this past year, it actually went down. The paramedics went down. So is this an area? Let me just frame the question differently, because I want to go back to for fulfilling your purpose. Is this a would you think is a transitory stepping stone in the healthcare journey for a professional? 290,000 people, I don't think, are doing transient stays in paramedics. I think this is a way of life for them. But I do want to make note of the salary, right? The average salary, which I'll talk about in a second, as the cost of doing business in the world continues to skyrocket, it's not sustainable, right? So, first question: why are we seeing? So we saw a decade of the paramedic profession growing, and all of a sudden it has stopped. Why?
Well, first, let's establish a baseline. EMS is a career where people can be fulfilled, they can provide for their families, they can have some career progression. It is not a transitory career. There are, in any career, people who are ambitious, who want to take on more responsibility, get a larger scope of what they can do in terms of the care they provide. So plenty of paramedics will go on to become a nurse, a PA. They'll go to medical school. They'll run businesses. There's always going to be a throughput of people who are there for a while. They did what they did for maybe 5 or 7 years, and then they move on. But there's an equal and much larger group of people who've doing it for 20 or 30 years. So let's talk about growth, and let's talk about contraction. Growth is that there's still plenty of communities across the United States that are rural, that have zero access to emergency medical services. You think that it's ubiquitous, that it's everywhere, and the fact of the matter is that it doesn't take long, right, to start moving out of any major metropolitan area before you start getting into very rural that cannot afford EMS. Over a period of time, populations move, economies, are dynamic, budgets change, and then a community might, suddenly need, new paramedics. So there's growth opportunities. The decline comes from external factors a lot of times that are making paramedics ask the question, like, is it still worth it? So, for example, the rise of physical assaults on EMS providers is exponentially increased.
Wow.
So it's suddenly become almost a societal. We've said it okay as a society that it's okay to batter, to knife, to shoot at an EMS provider. And when I started, that was really very rare. And so over just a short period of time, 35 years, right, from the time that I became a paramedic, I have seen the profession and how society treats paramedics and EMS providers differently. So if you were to be a family person and you're going to go out and expose yourself to the same types of risks that law enforcement does, but for less compensation, that gets you to start to think. So, for example, let's take an incident where a law enforcement officer, a firefighter, and a paramedic are all tragically killed. The life insurance payouts for all three of those people will be very different, and the paramedic will be at the bottom of that, right? So, the family, the sustainability, the brotherhood, that you see with 10,000 police officers lining the streets when an officer is slain. I get that. That's deserved, right? They are a public hero, and we should line the streets, and we should, pay praise to them. But when a paramedic gets hit by a car while on the scene of a call, there's not that same level of, empathy and community response, and certainly their survivors are going to feel it. So those things start to weigh in your mind of, like, is the risk that I'm incurring here worth it? Sure, I'm fulfilled for a little while, and I'm taking good care of patients, but can I actually sustain this, right? And be a responsible, head of the family.
So let's talk before we get into, because I agree with all those points, but I think they're very, very, very important aspects of a paramedic that need to be unpacked. But let's talk about the training. What is the training that is involved? Because these are the topics I want to talk about, Dave. I want to really dissect, for lack of a better word, the paramedic EMS, because based on what you just said, I don't think that is something that's being done on purpose. I just don't think that there's advocacy for paramedics.
100%.
I just think this, advocacy leads to awareness. And so let's use this as a way to educate people on the training of a paramedic, the advocacy of a paramedic, that police officer that has, the big event. They have a PBA that's very, very, very strong, and they invest heavily in supporting police officers. I want to know about the advocacy of paramedics, but let's talk about the training that you guys go through. And the reason I don't want to know the training is because I have a very I'm confused, and I've always been a little perplexed on the compensation of a paramedic. The average salary right now of a paramedic is $41,000 a year. I pay my caregivers here more than $41,000 a year. And then the top earners are at $71,500, right? A family of four right now, it's difficult to support on $70,000 a year. And I go back to what you say of fulfilling your purpose. You could want to fulfill your purpose all you want, but if you can't put food on the table and feed your family, that purpose has to take a back seat to necessity, right? Surviving as opposed to fulfilling your purpose, which is more prosperity. But let's talk about the training. The training that involves you guys becoming a paramedic, because everything in healthcare is mandated by reimbursement, right? Let's be honest. And physicians get a higher reimbursement, so they get a higher pay, but they also have a higher amount of training and down the line. But last time I checked, insurance also reimburses for ambulance cost. Insurance also reimburses for a helivac. Insurance also reimburses for, life-saving services at a very high cost of that. I'll tell you that right now. The other day, a family member is being sued in Florida because they called the ambulance, and the insurance said that it was not a medically necessary event. I forget what it was, but the cost is $92,000. $92,000. They're charging this lady for being transported to the hospital. So, I know I'm preaching to the choir, right? Transportation and life-saving services are not cheap. So why wouldn't the compensation be commensurate with the reimbursement?
Well, let's take a look at what the reimbursement really pays for when you have a ride to the hospital in an ambulance. It's not for the paramedics' 2 years of training. It's not their 20 years of experience, with thousands of hours of continuing education. What Medicare is paying for specifically is the vehicle transporting you, not the care that you provide. So a paramedic might be monitoring your electrocardiogram and giving you a breathing treatment, and then doing another intervention, right? Giving different medications. None of that is what we bill for. What we're billing for is the vehicle itself. So if you back up from that into how do we compensate a professional, right? You have to understand where does the money come from and where does the money go. So if you were to take a graduate nurse who completes a 2-year associate degree, probably they're going to be somewhere in the neighborhood of $60,000 or $70,000, by their second year of working out in the industry. It would take a paramedic to do a couple of extraordinary things to make that same kind of money. Understand paramedics work for different types of employers. The least that they're going to be paid is when they volunteer, right? So probably half of the country still provides EMS on a volunteer basis. So if you do that, you are really stepping up to be altruistic because you're not doing it even for money. The next place that you might go is working for an ambulance service. This is a for-profit model, right? And so you're probably going to be paid, the lowest if you're in an actual compensatory means. Whereas the highest paid paramedics work in metropolitan areas for fire departments. They're both a firefighter and a paramedic. And when you mentioned earlier, the average salary, and you talked about a range, and I thought the high end of the range was around $70K. They'll well exceed over $100,000 in those areas. But those jobs are highly competitive. They're going to take the best of the best. And so you really need to, my advice to anybody who's ever even thinking about entering this profession, think about your long game. What employer is going to want to prioritize taking care of your mental health, your physical health, your career progression, right? It's probably going to be a municipal type of organization, either an EMS organization or a fire rescue organization. So then jump over now and let's talk about how paramedics are trained. That is a model that, if you want to talk about what's broken, our curriculum is established by the National Highway Traffic Safety Administration. So the second that you have a clinical healthcare curriculum, right, for a profession controlled by people who, manage roads and highways, there's something broken. But this was the initial funding mechanism. This was the initial agency that stepped up in 1966 when we didn't have paramedics that actually formed them. And we've just been aligned with them ever since. So once we get through school, our allegiance is to our employer, and we work really very closely with a physician. So everything that I do as a paramedic is delegated practice. A physician says, when my paramedics respond to these calls, these are the things they could do. They can give these, types of injections. They can manage these airways. They can give medications. They can defibrillate. They can do resuscitations. They're basically prescribing for me the things that I could do. Once I exceed that, if I know through my training that there's additional care this patient provides, I can then call the physician via radio or phone and go, look, I'm on the scene. Here's what we're experiencing. I want to do X. What are your thoughts? And it's really, going back to how you open up the podcast, it's really a collaborative, consultancy. Sometimes they'll say, if you're a few minutes out, I want to see the patient before we go do that. And if you're 30 minutes out there, say, absolutely go ahead with that additional care. Our training is a combination of, classroom, physical skills, and then we spend over half of our education on ambulances, in hospitals. So we'll be in the emergency department, we'll be in surgery, we'll be in obstetrics, we'll be in pediatrics. We're physically almost through an apprenticeship model. The material that we learn in class, we then go into an environment with experienced healthcare providers, nurses, respiratory therapists, anesthesiologists, surgeons, and we'll learn from them directly. So we're seeing patients in real time, applying what we learned, and this is all forming your education. And then we're a licensed entity, right? So we'll get licensed by our state. We could also be certified nationally so that there's reciprocity. If you live in a state which is, close to another one, I've seen plenty of paramedics who work in more than one state.
All right, so I'm listening to all of this, and I'm even more confused. So in Cincinnati, Ohio, is where the first civilian ambulance service was established. So the EMS system began in 1865, almost 150, 160 years ago, right? If I do the math correctly. And 160 years, we haven't had anyone advocate for a better way of having our paramedics, which are, again, people have been dying for 160 years. I mean, last time I checked, the life expectancy is decreasing in the 70s. I can go through, crime is up, drug use is up. You mentioned earlier, cardiac events are up. If I talk, again, this is with all due respect, in fulfilling your purpose in something you did for 20 years, what have you done to change this, David? Because it seems like if we're not doing anything for existing paramedics, and we're seeing that last couple of years was the first year that paramedics decreased, this is not a very coveted profession, but one that will continue to have supply chain needs. And I'll use your word, altruistic. Altruistic is for us to leave what we have passion for better than we entered it, better than we found it. How did you leave paramedic and EMS world better than you found it?
I put my energy into creating better systems. So, if you were to look at some of my peers, they might be focusing on benefits or survivor benefits or pay. The battle that I chose to take on was creating better systems to care for patients. If you put the patient in the center of the universe.
But to take care better for patients, you got to take care of the people who are taking care of the patients.
You absolutely do. Yeah, you make a really strong argument. I totally get it. You put your energy where you think you're going to have a net benefit. And you can only beat your head up against the wall so many times before you realize that that's not a practical
Who's the
exercise.
advocacy group for paramedics?
The problem is there's too many, and
Because
as a result,
that transportation thing to me,
their voice is
just
diluted.
that's ridiculous, right? That the transportation is what regulates you guys. That should have been changed between 1865 and 2024.
Well, an important distinction. There really was zero organization, right, as a nation in EMS until 1966. That soldiers who were being wounded in Vietnam, who were medically evacuated and in the hands of a surgical unit within 1 hour, showed much more likelihood to survive than in previous conflicts, Korea and World War II and the Great War. And so that was then, the question was asked, why do we have so many people dying on the highways in our country, right? If we can save somebody in Southeast Asia, right, from catastrophic injuries, why can't we do the same thing in the United States? So that's when we started to get really serious about it. Everything before, you'd be surprised to realize that ambulance services were run by funeral homes. There's a little bit of a conflict of interest there, right? To your direct question of why haven't we improved the quality of life and the sustainability of the profession? It's because we've managed to dilute the voice. There's probably over 20 advocacy groups who don't play well together, who have some niche within the EMS career field, and they're trying to hold on to their little area instead of reaching out right to their colleagues across the aisle, so to speak, and saying, what if we were to combine our voice? What if all 20 of us got together and we were to fight for better benefits, better, pay, whatever the case may be for EMS? That's not happening. So, for example, the International Association of Firefighters really aren't standing up and saying, hey, and also look out for the paramedics who are working on the private ambulance service. It's just not within their interest. And so if you are an agency, right, that has control over the purse strings, and 20 different voices are coming to you.
Lobbyist.
Yeah, you're going to be like, wait a minute, you guys can't even align on what you think is important. How am I supposed to know?
But again, we have 290,000 of you. 290,000 of you that are stronger than 20 organizations. And if 290, and I can look up 10, 20, 30, 100 different organizations that have less representatives than the EMS world does, and they have more financial muscle and more lobbying power than you guys do. So that to me, it doesn't really hold value. And you're right. The source of federal funding and oversight comes from the Office of EMS under the National Highway Traffic Safety. That is a travesty. That is a travesty, which is part of the United States Department of Transportation, which right now is not doing too well with bridges falling all over the place.
No. EMS really needs to be attached to medicine or public health.
You think?
Bottom line.
But who is going to advocate to do that? My goodness, no one has put a bill in front of Congress. 1 + 1 = 2, and medicine is not transportation. Why hasn't that happened?
Because there's not enough people reacting with the same level of energy that you're reacting to the situation. You look at this and you go, this is a travesty. Of course it is.
Wow. Question for you. Why can't we nullify people from volunteering to be in the EMS system? If they were volunteer physicians or volunteer physical therapists or volunteer chiropractors or volunteer nurses, I guarantee you that their advocacy groups would pipe that down real quick, because what you're doing is a skilled service.
Of course.
Skilled service shouldn't be on a volunteership.
If you want to call yourself a professional, you first have to understand your value. And if you're not taught early as a professional, like you wouldn't find a lawyer who's going to give
free
service. Maybe they'll do a little bit of pro bono. They're going to give 5% of their time over a calendar year, right? Fine, that's their corporate culture. But to say, I am willing to sacrifice everything to be able to work this job. I think that's dysfunctional, and it needs to change.
I agree. And hopefully this is the start for us to educate the audience that those guys are there who are, wearing their figurative capes, right?
Yep.
Who are the actual heroes, who are actually making the difference between life and death.
So let's go back to one of your questions earlier. How are we trained? If we're going to call ourselves a professional group of EMS providers, that we need to make sure that we are developing leaders who actually can facilitate and organize the profession. If you go from working or learning as a clinical EMS provider and you work for 5 or 10 years and then you get promoted, nothing in your clinical initial training prepares you to lead other people. Nothing in your clinical training prepares you to work with lobbyists or elected officials. So you're now out of your league. You have been, it's kind of the Peter principle. You have been promoted to a level where you're suddenly incompetent to be able to lead the EMS system. And so things like fighting for your profession, for benefits, become really these ill-informed and ineffective, efforts, and they go nowhere, and nobody's really, caring about that to say, let me go help that guy.
No, I don't disagree. That you can pretty much paint that brush across of all healthcare. I'm a physical therapist. We are not trained to lead businesses. We have physicians here, NPs, dietitians, pharmacists, nurses, social workers. None of them are trained how to lead, how to be entrepreneurs, and that is intentional.
Yep.
It's intentional, right? Because they need the worker bee to build the business so other people make more money. I mean, I think that is it's capitalism, right? But I also don't take that to me as an excuse, right? Because we live in a world of abundance of knowledge. I can get an education on anything. Forget college. I can go on YouTube. I can go on TikTok. The resources that I have to access information are more ubiquitous, to use your word, and more abundant than they've ever been in the world. So, again, I challenge our fellow paramedics. I challenge our fellow EMS workers that are listening. I challenge our healthcare workers, myself included, to be a voice for you guys. And you said that. We hadn't had a voice, but we got to get one soon, because I don't see your services at any point in time decreasing, the need for them, at least unless we can figure out robots and AI to do these services. But I doubt it, right? Because it's a very invasive and there's a human aspect to it. So I think we've been able to skin this cat very well. And the fact that the level of education, the level of training, the level of professionalism, the level of care delivery does not coincide with the compensation, which is affecting not only the enrollment of prospective paramedics, but really the lifestyle of existing ones, right? And let's segue into you are part of that ladder where it affected you. As you said, you thought more about quitting than you did about staying, which is a very powerful statement. I will tell you, I have never thought about quitting my job here, ever. And I think about more about staying and how can I grow. And, I have a very highly ambitious mindset. And there, I always say we're doing really well, but we're very much in infancy. So let's talk about back to your purpose, back to who David wants to do, back on how we can help, to your point, existing paramedics, future paramedics, by improving what you mentioned at systems of care. Let's segue into that, because I'm hoping that the systems of care act as a way for us to go to a decision maker, maybe at the Department of Transportation, or maybe one more logical audience that appreciates what we do, and we're able to improve EMS and actually forget about saving the lives of the patients. I want to change the lives of the EMS personnel. So how are you improving the systems of care? Let's segue into that.
You first have to understand, epidemiologically, how do people suffer? How do people die? And not all death is equal. The loss of any loved one is always a travesty. The loss of a loved one who has 50 years of potential life ahead of them is just a terrible thing, and it's preventable. If you believe that certain diseases and certain situations are immediately life-threatening and survivable, then you have to make an assessment. How reliably do we execute EMS services every day to be able to make an effect on an immediately life-threatening problem? Somebody's T-boned in an intersection, right? A tractor trailer runs a red light and crushes it into a car, and now there's 3 people critically injured there. From the second that situation happened, we're all in responsive mode. The way that I'm helping with systems of care is I'm thinking about before the accident happens, right? What led to the fact that we made it possible for a tractor trailer to blow through an intersection, right? The call that I don't have to go to is the best call of all. So, I'll give you a couple of examples. A preventable accident because the roadways are constructed poorly. Somebody who has a stroke at 45 years of age when they're still, upwardly mobile in terms of their career and their earning potential. A 17-year-old, volleyball player at a high school experiences a sudden cardiac arrest. From the minute that all of these things happen, there is a predictable response, and it's not always effective. In order to understand its potential, you have to dissect literally every aspect of the response and to figure out, is it optimized? So in my particular case, helping to improve survival from cardiac arrest means looking at all the different components. So you place a call to 911 because you hear a thud upstairs in your home and you rush upstairs and you find a loved one unconscious. They're not breathing. You call 911. It takes 20 seconds for them to answer. They determine where you are and what your problem is. Then they tell you to stand by on the phone and they transfer you to a second 911 center. It takes 5 to 10 seconds for them to pick up. They ask the same questions. Where are you and what's wrong? Then they're going to start asking questions about, are you awake? Are you breathing normally? And then they're going to start to alert who's ever predetermined to respond. That period of time, from when you heard the thud until somebody is actually activated to begin driving to your house, that might be 3 minutes. And in some cities, it could be 7 minutes. When we opened the podcast, we talked about 600 seconds. 600 seconds is 10 minutes. So if we're 7 minutes in to your life-threatening situation, where literally every second millions of brain cells are dying, and now we dispatch somebody at 7 minutes, and it takes them 3 to 5 minutes in an urban environment to get there, we've now arrived to do all of these heroics, lots of activity, and none of it will translate into a save. Because we didn't put the patient in the center of all that response. And now we're busy, we're showing lots of activity, it's dramatic, it seems heroic, but none of it works.
So your systems of care is looking at current EMS delivery systems.
That's right.
And then making an analysis on areas where you can pick up efficiencies so that predictable response can improve. That's your system.
Yes.
Okay. Tell me about the I don't want to hear about the theory. Tell me the application of that system.
Number one, make sure that people who are high risk in any community know CPR and they know the warning signs of, not the warning signs, but the actual symptoms and signs of cardiac arrest. Next, from the second that you call for help, that we're immediately providing a surrogate for what your heart should be doing. So if your heart suddenly stops, we need to provide CPR within 1 minute, right? That means, let's take, for example, the median age of a cardiac arrest patient is 65. That means that somebody in that household needs to recognize an emergency has happened, call 911, and begin CPR. Most times that does not happen, right? And if you talk about in public, it happens even less because people are adverse to putting their hands on a stranger, right? So we've taught 911 dispatchers how to recognize cardiac arrest by only talking to you on the phone and giving you directions of how to provide CPR before EMS gets there. This extends that 600-second window this creates physiologically the possibility that we can defibrillate you, shock, and we can, get you out of this non-productive state with your heart.
So, question for you: you mean that these systems don't exist? You would venture to think that a life-saving protocol, life-saving workflow would be audited to exhaustion early, often.
That would be false. That doesn't happen. There are over 5,000 911 dispatch centers across the United States. Only about half of them provide pre-arrival instructions. We're talking about the direction that the dispatcher would give to a caller of what to do, how to stop bleeding, how to do mouth-to-mouth.
And the purview of that oversight is also under the purview of the Department of Transportation?
No, they're in their own orbit.
Wow.
Most of them are run by law enforcement agencies. So a small-time sheriff might have zero interest in consuming the time of that dispatcher giving you directions. They'll send, a police car and a fire truck and an ambulance, and then when we get there, we'll start work on you.
Okay. So the systems of response and your prescription for it is that CPR needs to be administered within 1 minute. And if in the case of cardiac arrest, there has to be a surrogate requisition of what your heart is doing to know if you have to be defibrillated and all that good stuff. What else?
All right. When the professionals arrive, there are a ton of tasks that they need to do. And they also have a number of obstacles. One of the biggest problems that we're trying to overcome with whether it's law enforcement or fire or EMS is get them to understand the efficacy and the efficiency of what they're doing. One of the biggest problems they run into is that they stop CPR. They'll stop CPR to look at the ECG monitor. They'll stop CPR because they're moving the patient out of the bedroom into the living room. And every time that we stop compressions, we're actually reducing blood flow to the brain, and it has a deleterious effect to survival. One of the reasons why this happens, it's explainable and it's understandable. They get distracted. There's lots of things going on. But a key component to systems of care improvement is to measure and improve, right? Many EMS systems do not actually physically take all of the evidence from the EMS case and reconstruct it, right? Almost I'm going to use the word postmortem, but that doesn't necessarily mean that the patient has died. That in a post-incident review, they'll look at it and go, that for 80% of the call, we were providing chest compressions without interruptions. That's a perfectly fine standard. There are, however, EMS systems where that measurement might only be 45 or 50%. That means that there were 30% of the time while you're there with your patient, when you should have been compressing on the chest, you weren't, right? And so these things might seem excusable when you're on the call. We're hot, we're sweaty, we're doing lots of things, we're lifting heavy things, we're moving, emergently. But when you look at it from an effectiveness standpoint, these little things, if we don't pay attention to them, by measuring them and giving feedback to the crews, we're doing a disservice not only to the crews, but certainly to the patients. So much of what we're doing is measuring every aspect. There's a body of science that has been shown to be effective, right, in resuscitating people. And if you're not applying that body of evidence, in a highly reliable environment, you could argue it's medical malpractice.
All right, so I'm going to paraphrase. I'm going to do this for a reason. So the systems of care under David Lacombe are to make sure that granularly the CPR is administered within 1 minute. There's a surrogate oversight and requisition on the cardiac status. When professionals arrive, that there's a strict, expedient protocol action that needs to take place in the event of CPR, which can be very exhausting, that we are not seizing cardiac compressions, chest compressions, that is properly handled, and that we leverage the extensive body of evidence that exists. Love it. I will give you even one more, which is very, again, customary to healthcare and medicine. Medicine, especially residents, they have something called M&M classes, mortality and morbidity classes. I think you guys in the paramedic world should do that as well, right? Have M&M classes as to what can you guys have done differently. If you guys, to use your word, your term, you're in your own orbit. My goodness, we need to get that orbit to be more of a city, not a galaxy, right? But so this is for the survival of the individual. I want David Lacombe to give me the same prescription for the survival of the profession. So what are the systems of care, again, that you just put forth are only going to take care of independent EMS sites. They're not going to do anything for the profession. This is a Band-Aid on a bleeding, gushing wound that, quite frankly, no one is addressing, right? And I use the word travesty, and it's becoming more of a calamity and a bigger travesty the more we talk, because, my goodness, I had no idea that under our nose, the paramedic EMS profession is so underserved. So let's give our audience, based on someone who has a tremendous amount of experience, and I want to get into the American Heart Association partnership because that's a very, very important part of the systems of care, I would suppose. Let's talk about forget survival of the individual, just for this conversation. Let's talk about the survival of the profession, because I think that if we work on surviving the profession, there's going to be more to this. I will venture to say in a level of high accuracy that the low compensation that is attributed to this profession has led to things that are almost common sense not being done. That's what happens, right? What happens when you're not being compensated properly for what you do or for what you believe in? You lose what's called passion, right? You lose that ability to self-regulate and self-improve in your skill set. So I want to hear from you. Let's apply those systems of care that you are applying to increase the efficiency of this EMS systems. Let's apply systems of care for the profession. So and if one EMS system or one EMS worker is listening and we change their way of doing things, then we're onto something.
All right. Well, let's take this from the individual first. I think before you even think about entering into this profession, you have to have a realistic sense of what you're getting involved in. If you, for example, see paramedics driving by, or you know somebody, a cousin or something, this is your opportunity to go, what's life really like? I think there are plenty of people who will make an investment to begin their training for EMS only to finally get employed in EMS and realize this isn't for me. And that took up a seat for somebody who wanted to be there. That's a lost opportunity for the person who invested a couple of years in their life. So having a sense of what are you really getting involved in? What you're getting involved in is a profession where you're going to have sleep deprivation. You're not going to eat on time. You're not going to be able to exercise while you're on duty all the time because you are so busy. You might, feel unfulfilled. There might be other instances where you don't really understand how you're part of a bigger EMS system. So I think step number one is to understand what you're getting involved in. Step number two is once you make the decision that you're going to enter in this profession, you have to adopt healthy mechanisms to be, that contribute to you being, a valued contributor to, to the overall, team. So what does that mean? Physical fitness has to be a priority from day number one. Nutrition has to be a priority from day number one. Going from sedentary of sitting in, the station to receive a call where, there's a multi-vehicle collision and two, vehicles are on fire and there's people trapped. You go from a resting heart rate of 60 to 120 while you're racing down the street. There is a systematic release, right, of hormones, right? Stress, cortisol, that's affecting your body, your heart, your mind, and cumulatively this takes a toll. So being able to anticipate this, having coping mechanisms to be able to deal with it, how to debrief afterwards. If you don't have those skills, it doesn't matter what physical and clinical skills that you have, you're eventually going to be a detriment to yourself and to others, right? The next is, I think there are too many EMS providers who go for their initial training and then don't really continue the education above what's expected. Like we're all expected to receive continuing education, but it tends to be the same topics year over year. And so I don't really see a lot of growth. And EMS, when it works best, if you take model societies, communities, Seattle, for example, is one that comes to mind. The paramedics are literally an extension of the Harborview, physicians, in one of the medical centers there in downtown Seattle. They have a very strong connection and relationship, and they treat each other as colleagues. Whereas in dysfunctional EMS systems, they're just a group of EMS providers that you see in a station, and they never ever see, a physician that comes to visit them who's, taking responsibility for, mentoring them. So I think that becomes, a limiting factor at some point as well.
So we have the systems of care of David Lacombe when it comes to EMS systems. So I'm going to paraphrase them again. Just listening to you talk, I'm getting more frustrated. Not because of what you're saying.
Glad to help.
Because of what you're saying. That endorphin response, cortisol response, that your fight or flight that you're referring to. I'm getting it as you speak because I can't imagine how this is going on daily. And ironically enough, we are in the position that we are as a healthcare system because of this. This is one of the contributing factors, and albeit a high one. So systems of care for someone who, again, I think this is something that this goes in line. Systems of care of the mechanics of the intervention of a healthcare provider, I think they take a seat back to a professional taking care of themselves. So shadow the profession so you know what you're getting yourself into, right? Make sure you have established, set, consistent mental and emotional support outlets. Ensure that there's a healthy collaboration with others. Make sure that you're physically fit and systemically fit, which is not the same thing, right? Physically fit, you can look fit, but you can have, as you say, when you have those pseudo-AFib reactions, that you survive that episode, because if you don't survive it, other people won't. Proper nutrition, absolutely. Sedentary and eating, fast food because you only have 600 seconds to do everything, and you probably apply. I always say how you do one thing is how you do everything, right? So if you're a paramedic, you're doing fast, it's probably how you do everything else. You eat fast, you go to the bathroom fast, and fast life usually leads to a short life. And I basically say you just have to take care of yourself. Learn to take care of yourself. And to me, that is the prescription. That is the prescription of how you change the profession and how you create a systems of care that caters to the end user, which is the patient. But to me, we're missing a big portion in the systems of care, which is the provider, right? That paramedic, which is, again, as I cannot believe that they're that underserved, and we got to do better. We got to do better for our paramedic profession, and I'm glad that you're here this is a call to action. Call to action
really
for our
is.
providers.
Yep. Call
Call to action to everybody who's listening. We have a really good audience that, at the very least, shake the hand of the next EMS provider you see. One thing that we have, and again, we've talked for an hour, which I think it's been a very, very good conversation, but one thing that we have remiss or omitted to talk about is how you have used your training as a paramedic to now kind of help other companies as a chief marketing officer and use it. I always say that this background, or any background that is foundational in nature with the beneficence of healthcare, allows you to supersede in anything in life.
Yes.
Right? Because essentially, it's this goes back to your character. This goes back to being selfless and taking care of others, sometimes before taking care of yourself. And that can be applied to anything. So I respect the level of training, and I think that we need to do more to appreciate it and hopefully improve it. But maybe that's another podcast. But now let's talk about how David has used that as and I'm going to use this term, as a soapbox to now be better in his other ventures. Let's talk about, and I want you to kind of segue yourself into the American Heart Association and that partnership, to me, that is so impactful. And I don't think there's any paramedics that are doing that.
So there's some foundational things that made all this possible. One, as a paramedic, you're steeped in the scientific process, right? That in the early days of paramedics, it was really kind of cookbook medicine. When you see these things, signs and symptoms, the doctor wants you to do these interventions. The profession has advanced so far that literally it's an evidence-based profession right now, that paramedics are often consuming the latest literature just as their peers in nursing and respiratory therapy and medicine are. So that really enabled me to look at things in an objective way, to be able to use data to make decisions. And I think that's foundational to business. The next is relationships. This isn't my method of systems of care. I'm really here to tell a story about a movement, right, of scientists, of educators, of clinical leaders and thought leaders who shared an idea that more can and should be done, right, to improve a clinical outcome.
Amen.
And so that's what banded us together. One of the problems in any innovation, whether you're talking about in healthcare or in business or in technology, is that there really is no innovation until there's impact. So what does that mean? And it's important to understand this because this was the driving force for organizations like the American Heart Association, companies like Laerdal Medical, communities like Seattle, that all felt like more should be done. And we felt that there was a body of clinical evidence that told us if you do these things well, you're going to have a better outcome. And what frustrated us was that in so many communities, those best practices were not being done. And so it's one thing to have access to medical science, but if you don't apply it, then there's really no result.
Well, there's no governing body of regulatory people overseeing this by the Department of Transportation.
They're not even at the table, right, for this conversation, right? They're more of a statutory organization who's providing some standards, right, for how we train.
Statutory means that they're just limiting you guys to do less.
Exactly. So this is what led to my becoming an entrepreneur. When I left EMS, I asked myself one key question: where can I apply a lifetime of knowledge when providing care one at a time, and amplify that? So rather than one to one, it's one to few or one to many. And I had to embrace a breakthrough type of mindset that I didn't have to accept the status quo as being a terminal sentence. And I find that business owners experience this all the time. I want to be able to grow my business here, but we're really just the small mom and pop. I want to be able to break into this other market, but there's other thought leaders and key opinion leaders and other bigger enterprises there that keep me from entering, right? That this self-limiting mindset keeps innovation from really happening. So once you start to break through, translational science, how do we take knowledge and possibility that exists and actually act on it? That became the basis for my business. And so now I help companies that have an idea. They have, maybe it's a medical device or a new service that they believe is supported by the evidence and is going to make a difference in patients' lives, but they don't know how to go to market. Face it, a lot of innovators, right, may not necessarily come from the industry. Like, for example, you might have doctors that went to medical school but have never really, outside of their training, cared for patients because they went right into technology. Or you might have a technologist who has a great idea because they talk to people in the market and they don't know how to get it to market. So where I work with companies is helping them to understand their value, their problem market fit, their product market fit. And then we go and we talk to those potential customers to understand the jobs that they need done, and we're able to then translate. Oftentimes businesses talk at consumers, and consumers talk at businesses, but they're not actually really having a conversation back and forth. And the result is nothing happens. When we can get businesses and consumers to understand each other and work together, a lot of really interesting things can happen.
This is fascinating. Fascinating conversation. And I will tell you, it is, I'm going to simplify this. And I love listening to you because I see the passion that you have in this. But all you're talking about, David, is you're just looking for clinical minds to adopt soft skills. That's it. For them to be empathetic, for them to listen, for them to collaborate, for them to communicate, for them to listen, for them to communicate. I'm saying it purposely because we've lost, most innovators, to make an impact, they focus on the hard skills, right? my training, my experience, my credentials, my title, blah, blah, blah. But it's the soft skills that really make the difference.
Yes.
And if we apply this to the paramedic EMS world, and we apply it to the Fortune 500 world, soft skills are what make or break a company.
They absolutely do. A key issue that we're dealing with now is misalignment. That many times an organization will bring almost all of its employees together to talk about strategy. And at the culmination of that event, we start to ask questions like, how did it go? Do you feel like you're aligned to the strategy? And usually they get it about to an 80% mark of people voluntarily reporting, I get it, and I'm committing to it. The reality, about 23% of them are actually translating what they learned from strategy sessions and are applying it. And the breakdown is that we're omitting the essential step that all change, right, at the end of the day, is about alleviating fear. We resist change as a society, as people, because we're afraid it's going to affect us in some way. And if you tell me one time about this fantastic new innovation that you want to do, but you don't walk with me to understand my point of view, I'm not going to adopt it. And so this comes back to the translational science. It's one thing to have access to information, but if it's not applied, right, at the bedside, at the roadside, whatever you're talking about, then it's just information, and it's failed to deliver a result.
And translational science, without an infusion of soft skills to communicate it,
goes nowhere.
And I think that is essentially, what we need to talk about. Every time somebody says to me evidence-based means nothing if I'm unable to communicate, to build affinity, and to have trust from the other side.
100%.
And I will venture to say, as you're talking, I'm writing how I feel David Lacombe, with his background, should kind of preface or disclaim or position your message, because I think it's powerful, David. And you're applying a lifeline of knowledge 600 seconds at a time to allow you to make the most out of your product. That's what you're doing. Because ultimately, two things are what are translational to you. Applying a lifeline of knowledge where you adopted that by being the lifeline to others, of others. And you're using that to apply in your entrepreneurship, in your stewardship, it's a better word, to allow others to hone those soft skills so they can make the most out of their product. Because innovation without impact is irrelevant.
Yes.
But you're doing that because you're maximizing your time by making sure that everyone is maximizing theirs 600 seconds at a time.
You could easily apply that to almost every aspect of business, your personal life, clinical care, it doesn't matter.
100%, because I think there's something that we always tend to think that we have a tremendous abundance of, and it's time. And we don't, right? We don't. And I do think that if our audience understands that, the irony of the paramedic world is that it actually, we tend to think that the paramedic world and the EMS world deals with death. They actually deal with life.
Much more
so.
They
deal with life. They just deal with life in a different context. And I admire you. I admire you for taking this role and taking your background that we, again, chronicled really well during this episode. You're applying this to businesses, to your point, that can be one of the best translational sciences that, if adopted, will make any healthcare, non-healthcare, executive boardroom, and frontline team better. Because when you're able to make the most out of your 600 seconds, you're going to become bulletproof. And when you're bulletproof, the survival mechanisms tend to be less impactful on you.
Very well said.
I really appreciate you being on the podcast. I think you're an amazing, you're doing an amazing thing for your profession. I would love to be able to help you and be able to make sure that we're better advocates for our fellow paramedics. I am also a clinician. I'm also a healthcare provider, and I want to be able to, again, help the entire continuum ecosystem that takes care of our patients. And my goodness, if we're able to change the life of one with the conversation we had today, it's incredible. David, can you tell our audience where they can find your services? We can put a link down on the screen when we debut this episode, but I want to make sure that the audience has the opportunity to have your services and have your expertise, whatever they may need it.
My company's name is imperativesdelivered.com, and you can find me on LinkedIn at David Lacombe.
Imperativesdelivered.com. Jonathan will put it right on our episode. David Lacombe, a pleasure, a class act. I would love to be able to help you in your journey, and hopefully you can help us in ours.
Let's do that.
And we are changing the habits of yesterday by creating the new healthcare reality of tomorrow. Thanks so much, David. Appreciate you.
Thank you, my friend.